Hello. Good day, class. You're welcome to our today's class. We are still on the course PSC 201 Primary Healthcare. PSC 201 Primary Healthcare. In our last class, we stopped at where do we stop? Signs of what? Both the probable and what? Possible. Huh? She said probable and possible. Probable and what? Positive, okay? Alright, so today we go over to the family planning methods. Please help me guard anybody. Please. It's me so that they don't match this. What they match it now, the camera will fly. And I will start singing, "You don't hit my phone." It's only Indomie generation may not understand this song. She?
Yes.
Yes. They may not. What are the Indomie generation here? Why culture? Wait, you not even think twice. Because you'll be thinking about this. Alright, so now in that class we broke down this topic, and I said that I want to be a kind of discussion where you participate. It's not going to be a situation whereby I'll stand here and happen. Let us rap together. Let us do what? Rap together. Yes, our secretary. Oh, secretary. Did not come for meeting. Okay, let's continue until she comes. Let's look at the family planning methods. So these family planning methods are very, very essential for controlling what? Fertility. For controlling what? Fertility. Birth spacing of what? Birth what? Spacing. At the same time, preventing what? Unwanted pregnancy. And actually, under normal circumstances, if unwanted pregnancy is prevented, under normal circumstances, it will go a long way preventing what? Even abortion. Two of us, because sometimes is the unwanted that they abort. Most of the times. Yes. But there are some other situations where the physician may make a decision with respect to risk-benefit ratio with respect to the health of the mother, and they take some decisions. But apart from that, most of the time, the percentage of unwanted pregnant babies that we are conceived out of unwanted pregnancy, that the unwanted pregnancy came out of most of the time legalized unlicensed intercourse. Three of us unlicensed coitus. Three of us most of the time unlicensed what? Most of the time unlicensed what? It's only you rarely see couple that just because they didn't want to give, maybe they feel that it's not, we don't want another baby, because of that they will go and start looking for a way to remove the baby. It's rare. Rarely, highest maybe they'll blame each other and quarrel, and the baby has come to do what? Stay. You don't know about it. Three of us, it's rare. I've not seen anyway. Me personally, I've not seen. I have not seen. I said I have not. Did I say it does not exist? I say I have not seen. I have not seen two couple, two legally licensed couple that say that they want to remove their baby. I have not seen. I have not seen. Okay, so let's continue. Does it? What is noise? Hello? If you have seen, fine. I say I have not seen. What make you look like it? Are you forcing me to accept what you have seen? Second, get our book. Get our minute book. Now, we categorize this method under the following. We have the natural family planning method. So we have the hormonal methods. We have the regular methods, surgical methods, emergency wards, contraception, long-acting wards, reversible contraceptives. So under each of these, we have different types and methods under them. Okay, and we divided the first 19 students here into these methods. So I want us to look at them one after the other. The first one we started with the traditional methods. So I said we have just 5. Do you see, even have up to 5 minutes again? We have just, let me say, no. 3 minutes is okay. 3 minutes is okay. Why are you so enthusiastic about it? She's so enthusiastic about it. Why? Why? Maybe why? But it's okay. Because one day you see yourself teaching your what client. 3 of us. Yes. Alright, so let's look at the first one is under natural family planning. Under traditional method. So we have the natural family. Who has this one? NFP. Who has it? Okay, come. Secretary, come. Come and tell us about this. We have to just remember the focus. Just say 1 2 things about it, then go straight to the pros and what, the merit and what, the merit. Okay. Yes. Oh yeah, fast. No time to waste. Hello. We will not go here. We will not go here. We will never go if we don't worry. After I want us to finish this course. After we are done with this course, we can have discuss a lot of things. I know there are a lot to discuss. I know, but we need to finish this course. If possible, to finish this course before we vacate. I would like it. I say, watch my word. I say, if possible. I say, if possible. Oh yeah.
Method of family planning. So natural method of family planning.
Can you increase your voice?
Family planning method.
Increase your voice.
Natural family planning method is a non-drug, non-device method of birth control that involves tracking your body cycle to identify when you are most likely to get pregnant. And we have several methods under the natural family planning methods. Number 1 is calendar calculation, which is also known as reading. This involves tracking your menstrual cycle to identify when you are not fertile. So under it, I will teach you how to calculate your calendar to know when you are most for menstrual cycle. of fatality, such as knowing your body temperature and keeping track of your mucus secretion to calculate your fertile days in your cycle. Then the third, basal body temperature. During your ovulation, your temperature might increase by 1/2 or 1 degree. So by that time, if you can use a thermometer to check it. So it will let you know the time you are ovulating. Your temperature might increase by half or 1 degree Celsius. So the third step is cervical mucus method. This help you to track your ovulation days based on the quantity of mucus around your cervix. It might be clearer, it might be thinner, it might be stretchy like raw eggs. So the fourth one is sexual abstinence. I don't know if that is correct. Abstinence. This term of pregnancy prevention means avoiding the activity that allows your sperm to enter the vagina. Partners need to avoid penetrative vaginal sex and other activity in which sperm could make contact with the vagina. This means you have to, in any way you can do, maybe withdraw to make sure sperm does not get into your vagina. And the sixth one is the lactation monoria method. This means people who are still breastfeeding and infants who is younger than 6 months are not likely to get pregnant. So that this method too is among the natural family planning method. Then the last one is the standard days method. This means, as we've calculated this year, this from here to 31. This one is talking about the standard days method. This means you can have sex within this period of time, and you can only have sex without using protection or any contraceptive within this period of time. So I want to talk about the advantages. The first advantage, there is no side effect. It does not have any potential side effects of hormonal contraception like mood swing, weight gain, or nausea. And the second one, it can align with religious or ethical belief about birth control. And the third one, no device or surgery is needed. It does not require any medical procedure. It is natural. And the last one, it involves your partner. Involving your partner in this process help in increase feeling of closeness and trust. And the last one I'll be talking about is disadvantages. It can be less effective than other method of contraceptive. And the second one, it requires both partners to be committed and cooperate. The third one, it may not be suitable for people with irregular period or condition with polycystic ovary syndrome, which is
wonderful, but so no problem. I said allow her. That was so detailed. Am I communicating? Yes, I wouldn't talk much on that, but there are apps that can even help you to achieve this. There are apps that can help you to achieve it. You know, the major problem with it, I keep saying that. The major problem is whether that we have not actually messed yourself up with contraceptives. The major problem, apart from that, the major problem with this is discipline. Am I competing? Sometimes the man may not even, the other may want to keep to it, but the wife want to do something. Especially during that ovulation period. Especially during that what? Ovulation period. She wants to do something. You like talk from that till tomorrow, you're on your own. Sometimes men may not even be the issue. Am I competing? Sometimes some women even go behind and go and take injection. Even their husband knowing. I'm telling you practical experience, knowing, because they want to do something during that what? Ovulation. And you know that even those that don't even want to, are not even that, like sex that much, but doing that ovulation is always something else. Okay.
So the person is doing that and the injection because of that it's baseless. Because when you are on injection during for contraceptives, you don't ovulate, you don't see your period, your body is just straight. So for a person that decides to take injection because the person wants to have sex during ovulation, the person has lost it all because it will not work out for the person.
Yeah, that is the issue now. Listen, they're all together. You don't understand. The person already knows her cycle. So to avoid long stories, so that touches that he doesn't want to conceive again, he doesn't want to do anything, but he want to do something during that period because of the.
That's what I'm saying, sir. There will be no feeling of ovulation because of the injection that the person is taking.
There will be no feeling of ovulation. Hello, listen carefully. Hello. I'm talking about heat period. You want to do something. I'm not talking about ovulation now or whatever it is. I'm talking about you want to do something.
Yes.
To them, this you are saying is not what they want to do something.
No, I'm not going to argue for that, but the truth is that if you go and check further about the side effects of most injectables as family planning, is that most people, even if you see your period, it is not constant. So the fact that you're not having a constant period will not even help you for your body to align for you to have ovulation. So most people that take injection, I can tell you around 80% of people that take injection or injectables as family planning, it tends to kill the sensation of sex. Yes, it reduces it. So
is it killing or is which one?
It sometimes it even kills it. It depends on the person, but it reduces it most of the time because your body is not performing the way it's not to perform. So it's not 100%, but I can tell you around 70%.
It's not general. It's not general. Hello. It's not what general thing. Am I communicating? Hello, listen. It's not general. Am I communicating? It's not general. It's not general. You cannot. What you are saying, you cannot generalize it for everybody. Okay. Some still want to have sex. Whether they.
Because how you see it?
I've seen somebody that did this. I still want to have sex. What's your issue? It's not general. Accept it and stop this. What you are saying is not general. I have seen, so it's not general. Am I communicating? That's the point I'm making. I'm not saying that what you are saying is not true. I'm saying it's not general. It's not everybody. But I've seen. Hello? Am I communicating? I've seen. Are we together? Yes. Hello? Nothing. Not a human body is general. Am I communicating? You may say greater percentage. That's how to put it. Yeah, but it's not. Whatever I'm telling you from experience. I've seen this one. So it's not a general thing. Even if one what as they call it, it's even it. Am I communicating? Depending on the population of the person. Am I communicating? So that's why I say it's not what general. But the point is, I'm trying to point out what can make someone not to stick this. That's where this what it came from. What can make somebody not to stick to you need, apart from some people that have issues natural on their own, irregular, may come as a result of PCOS as you say, and any other cause. But the main thing you is that If you can have a regular cycle, if you have a regular cycle, there are some apps you have in your phone. You see that it works. It works. There are some apps. This from I call yellow region. There's one app I know, Get Baby, from here to here. But we didn't have the main inflation day. Because which one now can have vitamin the inflation day in this range. You know it's a range, hope you know. At least it may not be but at least from the calculation.
After your cycle may last for maybe 3 days or 5 days. So the days between that 5 days to this point of 18.
Hello. Does anyone have an idea of how we can even determine? Oh yeah, come.
Between this week, between these days, 1, 2, 3, 4, 5, 6, 7, 8, we have so from behind you will count 1, 2. From the front you will count 1, 2, and so the mean in the middle. How will I put the English? Because the yellow. That is the name. You know, from the back you count. Let's say 2 years, 2 years, 2 years. Yeah, okay, 2 years. So we have 14 is your main ovulation day.
Which happens? Which happen to 2 days? Just 1 day. Yeah, 1 day. But hello, after that, for the prediction. Hello, are we together? The urge for sex may not be that day. Hope you know.
Yes.
It may not be exactly that day. Are you aware?
Yes.
It may maybe a day or two. Sometimes maybe a day after. It may not be exactly that. Sometimes it can be, but it's not compulsory that it must be that day. Am I communicating? We want to give you the exact. If you can monitor your cervical mucus, if you can monitor it properly, some are careless, they can monitor it. Some not even know what's happening in their system. Am I communicating?
Yes, sir.
If you can monitor it properly, that in fact that one will give you the exact. That one has no. But how many some people so some a lot of things come out from there. They don't even know which is which again. It sounds funny, but it's true. I'm not competing. But so all these things, if your basal temperature but align and you're able to see your mucus align and the calendar is giving you everything pointing toward that particular day of a day 2 days, is clear that is where am I competing. And once it happened, it has what happened. But everything takes place within this range. Okay, within this range. From here, hello. In fact, sir, if you can even have patience. If you can even have patience, when I say you, I mean 2 of you. When I say you, I mean 2 of you. Exert patience and start from here. See how you do that. Are we together?
Yes.
All right. So we've seen the advantages and what. We've seen the advantages and what. So you make your decisions, and also depending on the pressure on the client you have, you find out the history and other things before you now know what is best for the client. Are we together? Are we together? Are we together? Then the second person.
Confidence, still a confidence.
Confidence. Which one?
We don't have
Tell us about the one. This one won't take up to 1 minute now. Sure? All right.
Good everyone.
Yeah.
So I'm Chile Confidence, and I'm here to talk about the withdrawal method. Withdrawal method is one of the method of family planning. First of all, what's family planning? Family planning is an essential control of infertility, child spacing, and unwanted pregnancy. And we have 6 methods of family planning. We have the traditional method, we have the surgical method, we have barrier method, we have emergency contraceptive, we have the lost long so 6 so I'm here to talk about the withdrawal method. This is under the traditional method. Withdrawal method is also known as coitus interruptus. This is a process where the man pulls out his penis from the woman's vagina before ejaculation. Before, oh, not during ejaculation. So how it works first, the man inserts his penis during the vagina during intercourse and pulls it out before ejaculation. We have 3 factors that determine the effectiveness of withdrawal method. Number one, we have time. In this time, it means the man must be able to must be able to know when he's about to ejaculate. The man must be able to know when he's about to ejaculate. And we have control. The man must be able to control his ejaculation to be able to pull out before he ejaculates. And we have consistency. Time and control works together to produce a consistent result. Now, we have advantages of withdrawal method. Number one, it requires no financial burden. You're not buying anything, you're not buying condom, so you are not dealing anything financially. Number two, it doesn't have any hormonal effect, unlike emergency contraceptives where it triggers the hormones. So it doesn't have any hormonal effect. Number three is easy and it's very easy. There's no stress. It's easy. Number, it doesn't even require medical procedure like implants or other contraceptive parts where you need someone to assist you. It doesn't require any of that. Then disadvantage is that it is not 100% effective because at that process some men makes mistake because during intercourse it's very difficult for men to pull out during that ejaculation time. So that is where the mistake often occurs. So it is not 100% effective. Number two, it doesn't protect us against STI or any sexual transmitted disease because it is done raw, flesh to flesh. They are not using condom. So yeah, there's no protection against anything because the guy is not going to come inside. That doesn't mean disease will not enter inside. It doesn't mean. So number three, it requires someone with self-control, a man that can be able to control. That's what it requires. Then in this method there are some people that it can work for, like people that has infertility now. There are some people that they have issue with their fertility, they will not be able to get pregnant easily. So if they try this method, it might work for them. So you understand, it might work for them. And people that has like their personal issues, some people will say, I don't want to take anything, I want to try this withdrawal method, so they can try it. Where's my phone?
What's that?
Oh. Yeah, my phone. So no, I'm not drawing. No, I'm not drawing. So yeah. So in conclusion of everything I've been saying here, withdrawal method is low cost, hormone free, doesn't require any hormone side effects. Why it has its disadvantage and limitation, like I've also mentioned, it is low effectiveness, like I said, and it requires self-control. What is very essential for couples to discuss and decide together the method that is suitable for them. Thank you.
Hello. Are we together? Thank you. Please, hello, please listen carefully. We are health care professionals. Let's be serious with these things. No matter what, people will come to you for important issues. You see, when they mention some things, you start laughing. Control yourself so that you'll be able to help people. Very important. Now, there's something I'm coming. There's something she said. What's that? I asked. Please, let's focus, please. I read somewhere that ask your question. Ask okay.
The fact of mention that even before sexual intercourse, some people like, okay, if the lady is pregnant at that point, when she's ovulating, there are some fluids that will be secreted from the vagina, which helps the spermatozoa to swim faster into the body. Then the man also, when he's aroused for sex, some of them they secrete this fluid also that is meant to carry some spermatozoa as well.
Okay.
And when you even hear that there was no penetration, it was just at the tip, but the person still got pregnant.
Okay.
So during this pull-out thing, even if the man notices that he's about to ejaculate, so long he has been in the act, even before ejaculation, pregnancy can still occur.
Of course.
So I'm asking the question.
Ask the question.
Because some people don't really know how true is it.
Okay, thank you.
Sure.
Thank you. Is that the question?
Yes.
Thank you. Now listen carefully. There's something she said. She was only talking about the man. Now, let me tell you the truth. So women also cause it. Let me tell you how they cause it. There are some women. I'll still talk about the issue of man. No. There are some women that you have agreed that you are going to use withdrawal, and they start, and the game will now start. And when the man is about to, the woman will hold on. Hello. Possibly, listen carefully. Possibly, it happens. Can we be mature for once, please? Listen, please. I don't understand what is going on. This is a very important topic. Let's focus and listen to what I'm saying. Now, possibly the man has succeeded in taking the woman close to climax, and he want to pull out. Are you mad? She hold it. Wow. And she forget entirely. She will forget entirely anything called ovulation, and at the end she will get pregnant. That's one thing that happens once in a while. It happens. That one. Then for the men, see, withdrawal method is not for 2 minutes, 1 minute man. Am I communicating? Yes. It's not for a 1 minute man. So if you are a 1 minute man, you are deceiving yourself. Because if you want to try withdrawal method, even if you succeed in withdrawing, you are making your wife angry. It's annoying. Sometimes I pity some women. It's annoying. Are we together? It's very annoying because you are not even doing anything. You are pulling out. It's annoying. That's the reality. Are we together? So that's why I say, if you are how long we last differ. How long we last differ, and there are other factors anyway. Naturally, apart from other factors kept constant, how long we last differ. Am I communicating? There are some that can 30 minutes, nothing is happening, nothing is coming out. I am being realistic to you. Some 20 minutes, nothing is happening. Is the girl, is the woman that will cry himself, stop now, I'm tired. But there are some, just foreplay alone, that thing you said, the seminal fluid has filled everywhere. And that's how intense the person will be aroused. There's some level of high percentage of spermatozoa will be inside that fluid. Am I completing? To the extent that he may just ignore nothing and penetrate. There are some, all these people that ejaculate on time before they even do anything. Say Jack Robinson, some may even know without even knowing that there's something has entered. Am I completing? But there are some that they can even do foreplay for like 10 minutes, 20 minutes. Nothing is coming out of that other place. Even when they penetrate, nothing. Am I completing? So people differ. Know who you are and know the one that is what best for you. And also, some people may have also messed up their sister. I think I made mention of this in our last two classes about healthy foods. Men, eat healthy foods, and you see yourself. You don't need tramadol. You don't need all those jargons. You kill yourself with. Eat food. You see, you don't even need to go to market to buy anything. Eat your own food. Eat food. Eat normal food. Eat good foods. Run away from processed food. Reduce alcohol. If possible, leave it entirely. Am I communicating? Avoid all these things. Water is, but can you take only water? You cannot do it now. You must take something else. You must drink. Either you drink coke, you must drink something. If you are a man and if you are a man here and you are married, or you have a client that is married and is complaining of not lasting long, apart from if other issues kept constant, no particular disease or something else, the person is okay, please, no, the person, first of all, the person give person like 6 months. Don't take anything liquid apart from water. Just don't take anything liquid apart from water. If it must be liquid, let it be fruits. Avoid anything processed. Eat normal food. You should eat. Eat your groundnut, eat your plantain well. Especially a roasted one. Eat it well, eat normal food. Give the person 6 months. The person will come and say, sir, I don't know what's happening. My wife will be crying. If other things being what? If there's no other issues surrounding, there's no health issues. What we eat alone can mess us up. Am I communicating? What we eat alone can mess us up. That's one thing I want. So for somebody that I started talking about it because I was talking about those that may not be able to cope with this withdrawal method. But because before they even pull out, some have even released it. Okay, is that a question? I said. Okay. Yes. Okay. Okay.
Do you practice something like masturbation?
Okay.
He said yes. At what age? I noticed that he started masturbation at the age of 13.
Okay.
So I came to realize that the nerves, the male veins are already weak.
Okay.
So you have to go to this stream.
Okay.
You want to give a book. It's a kind of concussion that's very, very, normally, no human being is not supposed to take it.
Okay.
And there's some cases like that.
Okay. All right. I see. Hello. Listen carefully. See, the person cannot take abo for life, cannot take medicine for life to treat that. See, if you eat well, give it a time to correct. I am sincere with you. Try it over time to correct itself. See, dieting is so powerful. You see, if you eat well, a lot of nonsense will leave your system. On a more serious note, a lot of nonsense. In fact, one is that you have a very strong immune system that even issues that come from a sort of infection will run away from you. The other one is there. Then so second, pharmacologically, a lot of things that have gone wrong will be corrected. Physiologically, will be corrected. But it's not what will happen. Bam. It will take over time. Once you are consistent, over time, just give yourself time. I'm telling you, I'm not telling you long stories and theory. I'm telling you evidence-based practice. It's not book. I'm telling you real life situations. Let's control what we eat. And you see yourself corrected. Am I communicating? So for us here, maybe we have our client that are in that situation. Once you have screened and there's no particular, I might even say, he may even be our husband self. He may not even be our client. Of course, your husband is your first client, two of us. So that one, if you start with him first and work on him, let him get himself first. But can they stop all these things they eat? That's the problem. Someone listen. Someone not listen. So that is one issue with this word withdrawal. So if you know those that are, if they are not actually work on themselves to the extent that they have not, that they cannot, they release on time, it may not be that easy to control, because before you know it, the person would have done what? The person would have done what? Poured everything, or pour some, and maybe the wife is in ovulation, and who know when the thing has happened. Then for the wives, if you are using that, please don't hold them. Understand? Remember, don't get carried away. Hello? Don't get what? Carried away. Calm down. Don't worry. With time, this will pass. Then we can now continue your normal listing. Are we together? Next person. What is she talking about? I think you mentioned that now, right? Who mentioned it? Okay, let's hear you. Take.
Good afternoon, class. My name is Ioza Marachi, and I'm here to present the lactational amenorrhea method. First of all, what is lactation? Lactation refers to a period of time when a woman is producing milk to feed her baby, which is also known as breastfeeding. Now, what is lactational amenorrhea method? It is a process whereby a woman is breastfeeding her baby for a short period of time to prevent pregnancy. In this process, breastfeeding may not stop the body from producing egg, because if egg is not produced, pregnancy cannot occur.
So is it may not or may? Which one?
May not. May.
Okay, that's it.
So, lactational amenorrhea method is a natural way of preventing pregnancy, like child spacing, and it is 98% effective. So it can only work for within 6 months after childbirth. So we have the advantage and disadvantage of it. The first advantage is that it is healthy and it is natural. Yes, it is the healthy way and natural way of preventing pregnancy without using any medicine. Then the second one is that it helps the baby to look good. Yes, if you are breastfeeding our baby, you notice that there's this kind of look they have. They always look good and healthy, and they develop very well. There's always different when breastfeeding and missing breastfeeding with milk. There's always different. So the third one is that it is high effectiveness. Yes, it is 98% effective for pregnancy, for preventing pregnancy. So the disadvantage of it is that it only works for a short period of time. Yeah, it can only work for just 6 months after childbirth. So anything within that, I don't know, anything can happen. And it may not be suitable for everybody. Yes, so women with health issue, it may not be suitable for them. So in conclusion, lactational amenorrhea method is healthy and is good because it is a natural way of preventing pregnancy, but it can work for just a short period of time, which is 6 months. Thank you.
Hello, thank you very much. Can I ask you a question? Do you think this works for women that are not doing exclusive breastfeeding? Can it work for women that are not doing exclusive breastfeeding? Okay, all right. It's for them that are doing exclusive, right? If you don't do exclusive and go try them, 2 months you are pregnant again. See, God is, you see, God, the one who said that God has made everything to be what? Perfect. God's creation is so perfect. God organized everything. It's we. Hello? It's we that is the problem. God has so, I don't know, God has so, are we together? Hello? Most people I see, since my practice, since I started practicing as a pharmacist, both in the hospital and community practice, most of the people I see that they come that still carry one and the other and they are pregnant again within how many months? Most of them so far in my practice. Are you no? It's a lie. Okay, continue. What other question? Okay. 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 On the 13th of next week, okay. And all my children are doing this. And that one, the 3 months. In the next 3 months, I will take it again. Okay. And I'll be seeing things. Okay. I'm breastfeeding that for 6 months. That 6 months, I will stop. And the one I'm carrying for 1 year. Okay. I know my mother, I didn't know that immediately I started on the patient, but they are deceiving me. That's a question. Can I ask a question now? Yes. Do you do natural family planning? It's a yes or no question.
No, the first answer already.
It's okay. You're not on my question. It's okay. It's okay. It's okay. Let's say it's for those that on the system to natural family. What I mean is not withdrawal or condom. I'm talking about those that don't take anything else in their system to help them. Once you submit your system to any xenobiotic to help you achieve, a lot of things may change. That natural one your mother was telling you may not work the way they were saying it again. It may not. I say it may not work again. It may not work. All this thing, she wasn't deceiving. Don't say she deceived you. She was telling you what they practice during their own time, and it worked, and it's still working. Am I communicating? But remember, I still maintain my stand that anything in medicine, nothing is 100. Not even in medicine alone, completely 100. We have greater percentage, and the other percentage is not that significant to control the effect. You say this is what it is. Am I communicating? Yes. We have a lot of anatomical and physiological difference. But one major reason that may cause that change is contraceptive. And that's why I asked that question. You see the answer she gave.
Sorry, sir. There is one perfect skill. That's what I have. They wrote natural.
There's no period. That's it.
No, it's white.
Wait. Hello. So far you take something else. It's no longer natural.
I know it's what you're asking me if I do take it. I said no. I don't take anything. I know you're asking me.
I ask you if you do natural planning. You said no.
What she mentioned was that after a month from the period, she starts seeing a period. So I believe that is the green light. Yes, lactation and menorrhea means that no period.
I'm coming. I got her what she said. I asked a question. I said, do you use natural? She said no.
It's not natural.
Wait, I asked a question. We are discussing natural. We discussed natural family planning here, right? I asked, do you use natural family planning? She said no. Okay, let me ask you a question. Are we together? Let me ask you. You know, it's because you made it personalized now. That's why I'm asking personal question now. I ask, do you use natural family planning? Yes or no? Do you use natural family planning? Yes or no? But what? I said, do you, for you not to get pregnant, is it natural family planning you are practicing? Okay. Tell us, how do you do it? Tell us. What do you do so you don't get pregnant? Let me hear from you. Let's forget name now. Tell us the process. From there, we will not tell you what you are doing.
But this will lead to the second question. So what I do?
So what do you do? Tell us.
I follow that procedure. I saw you when I met that.
Okay.
That was the procedure.
Talk now,
the calendar procedure is what I'm taking right from when I started.
Is that what you are using?
That's what.
Till now.
Up till now.
It's okay. Okay, now if what she said that what she practices natural family planning, that means that means she's maybe among the little percentage that he may not work for. Am I concreting? That answer the question. Next, let's go to the next person. What does she have for us? Oh yeah.
Good afternoon, everyone. My name is Mary Joyce. I'm here to talk about contraceptive patch. Contraceptive patch is also known as birth control patch. I'm here to talk about contraceptive patch. It is also known as birth control patch. Is an hormonal contraceptive patch. Contraceptive patch releases combination of two hormones, which is estrogen and progestin. Estrogen help to prevent ovulation and thicken the cervical mucus from sperm to reach the egg, while the progesterone helped in thickening the cervical mucus and help in preventing of pregnancy. We have types of contraceptive patch. We have ultraviral what? I don't know, sir. I don't know.
You have what?
Ultra-viral. I don't know.
How can you copy something? You don't even know what to copy. After what? Ebra. What are you writing?
Ultra-viral. That is it now.
Continue. Hello. Continue.
Is a weekly patch that releases.
Please, sorry, no bad, sorry. Please, please, listen carefully, please. If you are giving assignment petition to me, please, let's take it serious. If you see some words you don't know how to pronounce, online you can Google how to pronounce a word, and the word pronunciation is simple. You do that learning. This is part of the learning method we are talking about here. No one knows it all. And if you learn it, if you have done what? You learned it. Next time, please, Google how to do this.
Okay, sir.
Please,
Okay, sir. Is a weekly pouch that releases 20 mcg of estrogen and 150 mcg of progesterone. While we have the second one is Zulene, which is a weekly patch also that releases 35 mcg of estrogen and 150 of progesterone. Advantages of contraceptive patch. It is convenient, like it is easy to use and easy to remember. It is effective. It is 99% effective. 3. It is reversible. It is something that you can put and you can remove it anytime you want. And it also helps to lighten the period and to help you to prevent this thing, menstrual cramp. While the side effect is skin irritation around that patch area, nausea and vomiting, headache, breast tenderness and mood swing. Contraindication, like for people that cannot use contraceptive patch. If you are pregnant, you cannot use contraceptive patch. If you are breastfeeding, you cannot use contraceptive patch. And if you have liver problem, you cannot use contraceptive patch. Or if you are smoking, you are not allowed to use contraceptive pouch.
Thank you. Thank you very much. Any contribution here? You are saying one. Okay. Oh yeah, let's hear from you. Microgram. You say what MTE means? Microgram now. Are you not doing farm calc here?
We are.
I don't do pharmaceutical calculations.
Yeah.
So you've not got here anything about microgram. Have you done pharmaceutical measurements? Okay. Someone said you just started. Okay, maybe you will still get there. These are things you should know by now. All things being equal. All right, let's the next person. So project what? Project now what? Estrogen. Are you sure? You say that it causes vomiting and the how? You are doing pharmacology now, right? AUM. So how will what you put here go and start causing vomiting and the so you don't enter and start causing what mechanism? What mechanism?
Affect the fight hormone. It can bring any change in the body system.
It can now in the system.
Yes, sir. Hormonal system.
Okay. It can move from hormonal to it can move from hormonal to neuronal.
I don't know
All right, basically hormonal and neuron they work together. They are the two coordinations in the system. Please, we are not in pharmacology class. So continue.
Sir, good afternoon, class.
You know this thing. I think you also do this in detail in your AUM. Yeah. But you are just mentioning. I don't want to go into pharmacology class. Okay. Just to mention, you know this one. You see, do it as a topic. I think so. Then in that case now you have to start going into the ability of action, what they do and how they exert all those actions. If you go into it now, we will not finish.
Good afternoon, class. My name is Olatunji Omoyemi. I'm here to talk about oral contraceptive, also known as OCS. Oral contraceptive. Yes, oral contraceptive is also known as birth control pills, and this thing they are popular method of contraception which even babies know, as in our teenagers they know it. They used to say our mom is taking daily drug, everyday drug. That's what oral contraceptive pills. Yes. What are the uses of all this aside from knowing that they are birth controls? What they prevent pregnancy, that's the first use of it. And here I have, they said it's up to 99% effective, up to 99% effective in preventing pregnancy while taken correctly. Let's note that while taking it correctly, it can prevent pregnancy 99%. Another one says another use of it why we use this is what? Regulating of menstrual cycle. Regulating of menstrual cycle, like what my sister Drew explained here, talking about your menstrual cycle. I know of a parent. So after giving her all these 3 months injection, this give us different complaints. So after the woman complained of the menstruation not stop and it's coming. So after I was like, I think. When I don't know, I have to call my boss. So it's suggested we should go back to that oral pills. By the time she use it to the middle, it will correct her system. So
Are you going to use it together with injection? As in,
take the injection and your period is not flowing, did not stop. So to correct your period, you can use oral into your circle. You have taken even before it expired, or even if after, anytime you have imbalance of your circle, your oral contraceptive. We're in the class due to Sister Shion. Sorry, I'm not in the church. From Shion. Praise the Lord. Honors. Treated polycystic ovary called PCOS. It helps to reduce the symptoms. Yes. When you have these symptoms that is really choking you, you can go for these oral contraceptive pills. By the time, even I tell you, by the time you get to take it to the middle, it will have correct to reduce the pain and your complaint on as in a patient that has this PCOS. Another one I said I have is reducing menstrual cramps. Most of us have menstrual cramps, and majorly our teenagers that have not given birth, because after you have started giving birth, your this thing will, your cramps will drop, which will reduce. If not totally, it will reduce. So this, if you are having cramps and you are having pains, use reduce the pains of menstrual cramps. It helps to alleviate menstrual, bloating and other symptoms. And what are the type of this? We have combined oral contraceptives. We have combined estrogen and progesterone. Combined one. And one is progestin, which is only pills, and it contains only progesterone. We have one that has both progesterone and estrogen, and we have one that contains only progesterone. And another type is extended cycle pills. Extended cycle pills allow for fewer periods. Extended what? This one is not only monthly pilling, extended based on the English. And we have another one here, emergency contraceptive. We have it like you use it after an unprotected sex. God bless you. After an unprotected sex, emergency contraceptive, like what and what should name it? Yeah. So when what are the benefits? Effective contraception and already 99%. And eight is ACENE. I'm in class. When you
It's happening.
yeah, clear skin irritation, maybe pimples and the likes. Thank you, ma'am. Now, regulation of menstruation, like I said earlier, it regulates your menstrual cycle. What are the possible side effects of one out, please? The possible side effects is we have nausea and vomiting. Yeah, many people say, I don't like this thing. The way I feel after taking it, I'm not comfortable. This headache also, your mood can change. You can have weight gain or you can lose weight. You can gain more, can lose more based on your own body system. And what also another side effect is breast tenderness. You're like when you're not on your ovulation you have this breast tenderness. It's the effect. And we have contradiction to this thing. People that should not contradict in don't agree. Those that are smoking increase the risk of blood clot in the body. So whenever you are the one that smoke, do not take oral contraceptive. Another one is age. A woman that may be a higher risk of complication. Your complication may come in diverse ways based on your whole body system. Another one is blood pressure. If you have this high blood pressure, you have those disease, or you have a complaint, or how will I put that one now? Oh, God bless you. When you have history of high blood pressure, don't say it because it's history of blood clot should go on oral contraceptive. And one of the important things to tell you this afternoon is that take OCS as prescribed. It will give you 99% assurance. And when you are reading also, I will advise that you use backup. You use backup. I know for I think I should come. Backup. What do we mean by backup here? If you are using this insurance, in case you forgot to take it yesterday, and you can quickly go for your Prosinol to quickly knock down and continue on your business. And this is something I will stop here. Thank you, everybody.
Hello. Women don't suffer. All this in for your body. It's not easy. All this is for your body. The man they enjoy. I think I previously gave us 3 minutes but I deem it wise to allow us to talk so we can share and discuss. I think we may not stop this today. We will not stop this today. We'll continue this until we finish this work topic. Okay? So this work, so others keep warming up. Keep preparing. We start from the sixth presenter, right? Sixth. Who is that? Barnabas Faith. What topic? Contraceptive ring. Hope you're ready. Research more, okay? Please don't come here and give us fake information. Please make sure you prepare yourself, because once you give it to ring in my ear, disturbs me. Please. Once you enter, it disturbs me. Even if I'm here, I will shake. But when you just shake, please, it takes me. Research well on what you are giving. The world has changed. Any information you want now, you can see it anywhere. Two of us, research, please. Let us build ourselves to research. Please, it's very important. Let's do that. Are we together? Yes, sir. All right, so I think we'll stop here because we just have so we can write our quiz. Hello. I made it clear to you. Our quiz is every Monday, but it's not compulsory. If you like, don't write. It's not compulsory. Leave it. But what I will assure you is that I'll bring that one day. If you miss 20 quizzes, I will sit here with you. You will write 20 quizzes. If you miss that day, that means your CA will be 0. So please make your choices and set your priorities right. Am I communicating? I will announce the day on time, so you start preparing for that day. Before your exam, so you start preparing for that day. No, before the main exam. After this presentation, please continue. We can write up to 20 quizzes. So the 5th one is today. Please continues. No. If kids are already on your holiday now, you go for a holiday, enjoy yourself for Christmas. If you come back, you continue. All right, please clear your desk. I want to see only your phone and your quiz exercise book. Thank you very much for your participation today. I enjoyed the class. God bless you.